the performance evaluation technical subcommittee. Thank you, Meredith. I mean, let's do introductions again. And your favorite ice cream flavor. Soy la Copiano, Housing and Stability Director and Chair of this subcommittee. And my favorite ice cream flavor is coffee. Anything coffee, and Salt on a Straw has a coffee and nut flavor. It's just delicious. I'm gonna put corn, and I'm going to with Marsha.
Hi, I'm Marsha Healy at Sequoia, and I love chocolate, and more chocolate. So, let's see. I will go to Sia.
Hi, everyone. I'm Sia Lindstrom with City of Beaverton. And my favorite ice cream flavor is double dark chocolate. And I will popcorn to Kiyomi.
Hi, Kiyomi Arbuckle. My favorite ice cream is cookies and cream. Catherine.
Hi, everybody. I'm Catherine, and with Department of Housing Services. And my favorite ice cream flavor is Jamocha Almond Fudge. A little bit of coffee, a little bit of chocolate, little nuts. And I'll pass it over to Allie.
Okay, how about now? Ooh, all right. Hi, everybody. Allie Alexander Sheridan, also with the Homeless Services team at Washington County. Favorite ice cream, I think, is what I heard the prompt is. I find this to be an impossible question. I'm a big ice cream fan. I would say anything with a little bit of salt. I also love Salt and Straw, so their vanilla with salted caramel swirl is my jam. I came in late, so I don't know who's gone. Zoe, have you gone?
Yes. Nadia.
I can go. Yeah. I do love Salt and Straw's vanilla with the salted caramel. I was just in Portland, and I was at a place called Kulfi, which has like South Asian style ice cream, and their rose pistachio is really good. And so I think that's my favorite right now. Yeah, I recommend it. They're on North Williams. And Nicole, I think you're left.
Yeah. Oh, good. And hopefully I'm last and won't have to play a memory game for half I wasn't here for. Nicole Sting, she, her pronouns. Good to see you all. Strategic Initiatives and Relations Manager in the Homeless Services Division. I am really struggling with this question. I'm just gonna say black cherry and chocolate combinations are what gets me, or any type of berry chocolate combination is what I'm gonna gravitate towards.
Meredith, do you get to go? If you want.
You're muted.
Too many buttons. Hi, my name is Meredith Cook. She, her pronouns. Administrative assistant, assisting with the Zoom. And my favorite ice cream, I was going to say chocolate, but coffee. Very good choice.
All right. Well, thank you. Well, let's move on. And we have in our agenda and hence rapid rehousing presentation from Ali. So take it over, Ali.
Oh, awesome. Thanks, Zoe. And I see there, I think you're sharing screen already. It's Nadia. So
Sorry, I was just having an issue actually showing the slideshow version. Let me try again.
Yeah, you know what we're doing. I do. I can also share directly if you want. Nadia.
There we go.
There we go. You can see most of it. Can everybody else see?
Is it not sharing the whole screen? Or is it getting cut off? It looks like it's all there.
No, it is. It's
Okay.
good. Mhm.
Great. Okay. Well, I'll jump in. Hi again, everyone. So I am bringing you all an update on the enhanced rapid rehousing pilot monitoring work that the homeless services team had get underway this past spring. I am standing in for Carly Brandini. She's our quality improvement coordinator. She is on a hard-earned vacation this week, so she knows the ins and outs of this project in the most detail, but I am standing in for her and presenting on her project that she's really built and led throughout the pilot monitoring. So I will do my best to answer any questions you all have about the monitoring overview, and any questions I can't have, I will bring back to Carly and she'll follow up early next week when she's back in the office. I think also, as part of the materials that went out to this group, the actual monitoring framework and checklist was sent to you all. So any questions about that, hopefully you all have access to that. And if it didn't go out, but I think it did, then we're happy to share the draft framework afterwards as well. Okay, so before I jump into the overview, just a couple of questions to tee up for you all. The first is, as I'm going through these materials, just having this question in the back of your mind of, are there adjustments that we should consider in our monitoring approach or framework based on what you learn about the monitoring framework and approach today? And then also a sort of broader question, how would you like the technical subcommittee to be engaged with this work as we move forward with future monitoring? Because this work will be changing and expanding in the fall, and I'll talk a little bit about that as well. So we'll revisit these questions at the end, but just wanted to sort of frame up my ask of you all here today. So we can go to the next slide. So I'll give a quick project overview, and I should say too, if you have questions that come up throughout the presentation, feel free to just interrupt me. I think I can see any hand that would go up since Nadia's sharing screen, and happy to just have you jump in and answer any questions. So with the enhanced rapid rehousing pilot monitoring, the goal of our monitoring work was to review the performance of service delivery and ensure that there is compliance with the contractual standards that are set out in the enhanced rapid rehousing contracts with providers. We're currently working to develop a comprehensive monitoring framework for all of our SHS funded contracts and programs, I should say. It was in our program year 3, which just ended in June 2024, as part of our supportive housing services work plan to launch monitoring for all SHS funded programs. So this was our kickoff of that. And because it was our first time rolling out monitoring for SHS funded programs, we piloted it at first with the goal of this being a learning experience. There wouldn't be any adverse impacts or findings from the monitoring if partners weren't sort of meeting the monitoring framework. It was really just to learn from the rollout of the monitoring framework. So we piloted this with 4 enhanced rapid rehousing agencies. We have 17 agencies total who are providing enhanced rapid rehousing services. And we used a random selection tool to select those 4 partners. And I should say too, that I think you all are aware that we do monitoring of all of our COC funded programs as a requirement of HUD. So we really based the monitoring framework and tool off of that HUD monitoring for our COC work. And then we tailored it for our SHS programmatic needs. We can go to the next slide.
I just want to add, I shared this spreadsheet that I think is the monitoring tool file that you're speaking of. It's in the chat if anyone needs it.
Great. Thanks, Nadia. So this is our timeline for the pilot. So agencies were notified in April that they were selected for the pilot, and so they were sort of given the framing that I just gave to you all about the scope of the pilot monitoring and the intent. And then 2.5 weeks, 3 weeks later, we shared the monitoring framework itself. So the file that Nadia just sent, we had sent that framework along to partners, and also the additional information about forthcoming steps in the monitoring. Then following that, on May 8th, we randomly selected 5 participant profiles. Again, you'll see that in the framework. They're randomly selected and they were shared with agencies in preparation for the file monitoring work. And then starting at the end of May through the first week of June, that's when we conducted the desk monitoring, and agencies were asked to submit the framework documents via email to Carly. And I'll talk a little bit about what was included in the desk monitoring and file monitoring in a second. Then starting in early June through the end of June, we did on-site file monitoring with the 4 agencies, and that's where we conducted the participant file review and followed up on any items that were outstanding from the desk monitoring that had happened a little bit earlier in the previous month. So that sort of wrapped up our on-site monitoring activities, and then starting in July, the monitoring framework and then also the individual level provider reports were completed and sent to agencies that sort of summarized our monitoring work with them. Next slide. So again, the framework will have a lot more detail about what was included in the desk monitoring, but just as a quick snapshot, the monitoring included guiding principles of the work. So a lot of this information is articulated in the program manual or the contracts with partners. We also monitored them based on their Community Connect or our coordinated entry participation and HMIS participation and documentation. We also monitor for policies on equal access, non-discrimination, termination, their grievance policies, ensuring that they had policies in place to get feedback from participants that were receiving services through the program. And then we also looked at some quantitative information like people served and how well they're utilizing their contracts. And then there were also some enhanced rapid rehousing specific requirements like case management ratios and assistance guidelines that we monitored as well. So that was the part 1, the desk monitoring. And then the second part was the file monitoring, which is the next slide. So for the file monitoring, we were looking at making sure there were releases of information or client consent indicated. We also were looking at ensuring that partners were assessing for program eligibility appropriately or had a process in place for assessing program eligibility. Client consents and acknowledgements, again, pretty standard for monitoring. And then also looking at documented case management engagement and notes in HMIS or elsewhere. And then also making sure that partners were determining rent reasonableness and asking if there were signed leases in the participant's name that they had gathered for enrolled participants. And then also, you all are probably familiar with our phased assessments as part of our Community Connect work. So again, just looking to make sure all of these things were documented and these services were delivered. I'll pause there. I feel like it's a lot of information in 6 slides. Any initial questions about this content? Okay, not hearing anything. I'll keep going. So we can go to slide 7. So I sort of alluded to this at the beginning, but we didn't do any scoring for folks that were part of the pilot monitoring. It was just a pass or no pass for each framework item, whereas we will incorporate some scoring in the final framework that is rolled out later this fall. That's not a pilot monitoring, but is the official monitoring itself. The final summary report, like I said, was supplied to each agency with recommendations for steps for how they could increase compliance with the monitoring framework and requirements. So again, recommendations for here's how you can improve, but we were clear from the beginning that again, this would not result in any formal findings, and that this was a pilot monitoring with our partners. Next slide. So some findings and takeaways. So some of the successes we saw and also heard from partners. We found that partners that were involved in the pilot, so the 4 that we did monitor, were meeting their contract requirements that were included in the framework. So overall, we found that partners were generally compliant with what's in the contracts. We also found that our partners demonstrated active case management with participants, and there was evidence of this active case management and working with participants documented in HMIS. We also found that our providers were prepared for the monitoring, had clear guidelines, and felt supported throughout the monitoring process. Some partners had been monitored before as part of COC work or other work. Others, this was their first time being monitored. But on the whole, they were prepared and engaged in the process. Next slide. So some areas of improvement that we found. So we found that more guidance is needed on RET calculations while using a progressive engagement approach, especially for participants who might not have a source of income. And so that's something that our programs team is actively working on addressing. Now, we also identified, or we found an area of improvement was identifying a tangible way to assess how flex funds or the financial assistance budget that's included in contracts are in alignment with the eligible expense guide. So we have our program staff who are actively reviewing invoices and making sure that those expenses align with the eligible expense guide, but we just need to make sure that there's clear documentation for how we're assessing that in the monitoring framework. We also just found that there's a need for, this one is less significant, but consistent form and documentation naming just for ease of organization and finding information. And then also there were some areas, I think this is on the next slide, where we found that some of what was in the included in the framework was a bit duplicative. And so there was some need for us to clean up the framework and make some edits. Based on what the providers were sharing and just what we learned and going through and doing the monitoring with partners. Next slide. So this was, I was alluding to this a little bit with the framework changes. So again, we found that some items as we were going through the framework were a bit duplicative. So we needed to condense that and make sure we aren't asking partners to submit the same thing twice. That we also heard from partners that it'd be helpful to provide links to documents or resources when we're asking for them in the checklist so that they have a clear understanding of what we're referencing. And then just adding clarifying language and instructions to support our partners and our staff as they're going through the monitoring. Next slide. So no findings that were really, I think, a big surprise. Outside of what you generally find when you're piloting a new program. So we also administered surveys to partners to make sure we were gathering their feedback throughout the monitoring process. So we administered surveys at 2 points during the pilot. The first was after we conducted the desk monitoring work, and the second was after all of the pilot activities had concluded. We got feedback from partners. One partner indicated that they had begun using our procedures, and that had helped identify the standard operating procedures that needed to be updated for the program as they were operating it. Another partner, we had some mixed review or mixed feedback on information and clarity around gathering materials and demonstrating evidence of HMIS participation, number of people served, and the rapid rehousing specific requirements that they were monitored on. But another, we also had feedback from a partner that was clear and it wasn't difficult to gather. So some mixed feedback from providers, but still good to hear that their diverse perspective. Next slide. So this is just a little bit more about what we heard from the partners. So we had 3 providers who provided feedback in the survey after the desk monitoring phase, and you find here that they generally felt that they had clarity and clear information instructions on deliverables and how to engage in the monitoring. So we thought that was positive on the whole. Next slide. And again, this is feedback after the final monitoring phase and final reports were sent. We had 2 partners participate. And again, they felt that they were given sufficient time to prepare for the monitoring. The communication was clear. They also had clarity on what was being monitored, participant files that they were needing to prepare, and then also clear understanding of what we were trying to achieve through the monitoring. And next slide. I actually will go to the next, if we could go to the next slide, Nadia, and then we'll come back to that. So our next steps in this project on the whole is, so we'll refine the framework based on our learnings and the feedback we heard from partners who are monitored. And then we also plan to launch a more comprehensive monitoring across all supportive housing services programs this fall. So it'll expand to include our HCMS program, our housing liaisons, shelter services. And our goal is that each of our partners will be monitored biannually every 2 years. And so a partner will have all of their SHS funded services monitored in 1 year, and then they won't be monitored the following year. And again, I mentioned at the beginning that our goal is to align this with our COC monitoring efforts, with timing and just with the monitoring framework generally, so that our partners aren't getting monitored every 6 months or every year, and we're really reducing the administrative burden of both monitoring and being monitored. Okay, with that, we can go back to slide 14. Okay, I feel like I've been talking for a very long time, so I'll pause here and just, again, have these questions up on the screen for you all about adjustments we should consider in our monitoring approach or framework, and how you all would like to be engaged in future monitoring work. Yay, Zoe.
I have a question. So this was only monitored subrecipients like work, but not the performance of the rapid rehousing itself. Like the system, like, is it working? How many people are staying in housing? How many percentage, from homeless to house, and then exit, success, or to permanent housing, like.
Yeah, that's a great question. Yeah, so this was just monitoring for essentially like how effectively our partners are complying with the contractual standards of enhanced rapid rehousing and delivering those services, not necessarily system performance and effectiveness. That is part of that is captured in the annual performance evaluation that we did back in the spring, where we look at all of the performance metrics for enhanced rapid rehousing and look at how our partners are doing collectively. But this is a bit different than that. So it's not capturing that system level performance to your point.
And utilization, like if the agents are utilizing, like filling out all the spots, that's also not considered in this monitor.
Well, we did look at contract utilization and households served compared to like the contracted capacity. So we looked at that for each of these 4 partners that participated. But again, that's looking at a partner by partner basis, not necessarily across the entire system utilization of all enhanced rapid rehousing. But I think to your question, my question back to you would be, is that something that would be helpful for this group to see that level of system performance and bring back information for you all?
Yeah. I mean, it's good for you guys to know how you are engaging in contracts with us and how you can improve internally those needs and gaps. But yeah, I feel like as a system, yeah, I would like to know the performance of the rapid rehousing, especially because it's new, right? And then we have so many organizations being part of this approach. And it's a different approach. We have the ARLA for population A, this is population B, which is needed as well, those at risk or presently homeless. So I would like to see if the system is working and if it's working to stabilize those households so they're not coming back or they're not going back to a different level of need, like population A. Like they are moving from population B to being stable and out of the system. Success.
Yeah, I think that's something we could definitely bring back to this group.
Yeah.
Great, thanks for that feedback. Anybody else? Adjustments, how you'd like to be engaged with future monitoring or performance evaluation work?
Yeah, hi Ellie, it's Marcia. I just concur with what Zoe already pointed out, that I think it would be helpful for this group to be involved and to have that systems view as well.
Great, thanks, Marcia. Okay, any other feedback? Would it be helpful to bring this information back with sort of updates, finalization, findings from our broader monitoring work that will happen later this fall?
Yeah, I have a question. So these contracts are for 2 years. Like this participants are in this rapid rehousing for 2 years, right? And so you're going to monitor for 2 years. Yeah. Yeah, that's my question. So we will know if it's successful. We will know if those are ending the program without looking into other rapid rehousing or shelter, but exit and a successful.
Yes, I don't know that sort of bringing this, I don't know that we'll identify all of that information through the monitoring, but I think through our performance evaluation and assessment, we could certainly bring back that information. So I think that's your question.
Yeah.
Okay.
Excellent. Didn't know how long. Okay.
Mm-hmm.
There might also be room, I'm wondering, to draw links between where there's a need to drive some system performance changes and the monitoring as well. That might be a helpful space for this group to weigh in.
Yeah. Okay. All right. Well, if any other questions or feedback comes up, I think you all probably have my email, but I'll leave it in the chat. And then again, Carly is our lead on this project and can likely answer any questions about, or anyways questions you might have or feedback. So with that, I think I turn it back over to you, Zoe.
Yeah.
Okay.
That was great. Thank you. I mean, the most important thing is that organizations are feeling supported, right? And this is great. So when you do the whole system monitor with the whole organization being funded, that's a good thing. Oh, I lost the agenda. But I think next is gathering with, yes, it's a report of our MAC group. MAC work.
Thank you, Zoe. So this agenda item is just our MAC monthly MAC report. So we submitted the July. This is the June progress report. So this should actually be the what was submitted for participants through June. So where and the big things that we're tracking are the plan objectives. So engaging with those shelter long stayers. And we're tracking that. We have 166 households with stays over 100 days. 40% of those are enrolled in a housing program. And then we had 57 housing placements in May. And then continuing to track our challenges. We haven't seen a lot of movement in these sections for challenges and highlights or our requests from the state in the last few months. We're just updating as we go. So shelter challenges continue to be longer than expected stays in shelter, the increased substance use and behavioral health challenges, staff retention and professional development, creating capacity constraints that impact system capacity and ability to achieve goals, and then engaging with households that are in more mobile, unsheltered situations like ours. And then for our highlights in the month of July, we successfully had an inclement weather event for heat and provided 51 individuals with emergency shelter, and then continued our progress in that case conferencing. So to address the shelter long stayer households in particular, the case conferencing has directly led to 25 households being housed since that process started in, I believe, April. And then just ongoing needs from the state continuing to be that health system alignment. So access to medical services, more flexibility in Medicaid eligibility determinations and the process for that. And then an ongoing need for options for elderly or folks that are not able to live independently or achieve their activities of daily living. And so these have been elevated to the state, and there are efforts underway. We've been given a contact that is used through our healthcare case conferencing that is intended to help assist with some system navigation internally at OHA. So jury's still out on whether or not that's been super effective in moving people through faster. So the question for you all is, are there any other challenges or highlights that you think we should add for the August report? And are there any other needs from the state that have come up that need to be elevated?
I think you have a good point with the staff retention there, because what we're seeing too is like we hire, train, and by the time that they're ready to go, they go. So it's a constant training, leading into like overall a position open for a long time. Like you seem that you're hired, right? And then that's, but it doesn't, it's still, there's still a huge gap. Yeah. So, you know, like 2 months you have a position open recruiting and and then you hire, you train, and they go. So it's actually like 7 months of that position being empty, totally filled.
Are you saying that like folks get through training and then leave, or that like that the one person gets through training and is in place and then the next person goes? So just like a continued...
that and and the other thing. And they decided maybe that's not what they wanted after training.
Hi, Catherine, it's Marcia. I guess I have more of a question than I am wondering, have you made any headway in talking with either OHA at the state level or Care Oregon about how you can facilitate engagement with behavioral health providers when the person does not yet have coverage?
I think actually punt that one to Allie. Allie, did you hear the question from Marcia?
I didn't. Could you say it one more time, Marcia?
Yeah, I was just wondering if the county had made any headway with either state, OHA level, or, the Care Oregon level, with trying to figure out how to get services, behavioral health services, to folks when they aren't yet qualified for Medicaid services.
Yeah, I mean, I think we're still trying to solve for the how do we get folks connected to Medicaid funded services. I don't yet. I think we're still stuck on that, and we haven't really even gotten to the before phase of that.
Do all the shelters have assisters, OHP assisters that can get people on Medicaid?
No, some do, some don't. They have positions that are liaisons that can become assisters, and but it depends on the organization.
I see. So I would think that would be some help.
Yeah.
There'd still be other challenges, but okay.
Yeah.
I can imagine just that the challenges with both substance use and mental health issues are profound and are posing big challenges.
We see a lot of need at the coordinated entry with homeless without health insurance. And we don't have a connection and a sister for that at the moment. We used to. But the health liaisons that are working with the family shelters, the family shelter network, they are a sister. So we're making sure they are connecting them families with health insurance, but that's the family shelters only, not that. Or coordinated entry, which
I think most anyone can be trained to provide that service. So,
yeah, I think some organizations have chosen to have their own staff trained to become assisters, and others have the list of assisting organizations that they refer to. And so it's still a little bit of a hodgepodge.
Yeah, it helps when you have your own. It really expedites things if you can bring it with your staff.
Great. Thank you. So I have adding to our challenges the need for increasing access to assisters in our shelter, and outreach. Would you include outreach in that as well?
coordinated entry too. Yeah.
Coordinated entry.
Yeah. Yeah, we have so many walk-ins with that specific need. And we know that if we provide a homeless individual or, somebody outside with the application or with the address to go to an ODHS office, it's not going to happen. So it's better, like you said, Marcia, like right there at the spot, let me help you engage and enroll. And there is no capacity to provide that essential social need.
Okay. Thank you both. And anything else to highlight for the August report? Okay. That's it from me. Back to you, Zoe.
So
Zoe,
I
are
think you're muted.
I have to screen, that's why. Next step, we will have our Q4 annual report for the homeless system. This is in September, right? Our September meeting.
In September.
Mhm. Also, coordinated entry, Community Connect, we will have a presentation for all of us to know a little bit of coordinated entry and data from them. And the notice of funding for what, COC?
There's the HUD NOFA that just went out. There was a Q&A that happened yesterday, and there should be a recording of that should go up soon. If anybody wants that, I can also send that out. But we should have like updates next month.
That's it. Anything else? No? Great. We can have
All we have.
15 minutes back. Yay. All right.
Thanks,
See
everybody.
you next month. Thank you.
All.